Welcome to the PT on Ice Daily Show, brought to you by the Institute of Clinical Excellence. My name is Dr. Jeff Musgrave, Doctor of Physical Therapy, proudly serving the older adult division. Today, what we're going to be talking about is a recently released randomized controlled trial titled Effects of Controlled Supramaximal High-Intensity Interval Training on Cardiorespiratory Fitness and Global Cognitive Function in Older Adults. The MIIT high intensity study. So, if you have been treating older adults for any length of time, whether you're a new practitioner or a seasoned practitioner, oftentimes there are things on board that we need to address for our older adults, excluding pain. So if you've been around for very long, we talk about this fitness forward approach, right? We know that a lot of our older adults will come to us for shoulder, knee pain, back pain, maybe balance. But when we look at their cardiovascular function, we notice their cognitive function. There may be some deficits there. And regardless of whether they have deficits yet, we want to bolster them, give them some reserve in the cognitive realm, in the cardiovascular realm. Sometimes we're treating patients primarily because of their cognitive dysfunction or because of their cardiovascular insufficiency. But the question becomes, what's the most efficient way to do this? What's a safe and effective way to do this? How can I maximize my efforts in the clinic to get the best outcomes possible? Enter this study. So what the study was is it was a randomized controlled trial of older adults who had no history of exercise, which is not uncommon for us if you're treating the general population. The older adults ranged in age from 66 to 79 years old. There were 44% males, so skewed a little bit more towards female population. And the two groups were high intensity interval training and moderate intensity interval training. So what they did is they had them exercise. They were exercising twice a week for 3 months. The protocols were power-based. So this is a little bit different. So if you're like me and you're a little fuzzy on your physics, it's the amount of work that you do across a measure of time. So they were measuring in watts. And then they were also looking at things like their maximum power output from an aerobic standpoint, aka VO2 max is what we typically discuss a little more commonly in most circles around aerobic conditioning. So they had a target power output to either put them at this high intensity group or the moderate intensity group. The high intensity group was based on a 6-second interval maximum output. And then the moderate intensity group was based on their VO2 max to put them at a moderate level. So we've got the two groups. If we look at the protocols a little more closely, so the moderate intensity was at 60%. And they did 3 8-minute bouts with a 3-minute recovery period. So 40% higher percentages of max aerobic power for the team doing the high intensity interval training. Participants were monitored for their cadence, their power output, and just general discomfort. Working at that high of an intensity, pretty uncomfortable. You're going to be gassed. You're going to be pretty out of breath. So after 3 months, what they found in this study was that there was no real significant difference between VO2 max, like peak VO2 max, or global cognitive function. They did find that there was an improvement in their cognition. The supramaximal high intensity group had a slight advantage on working memory. They also had improvements in their peak knee extensor strength over the moderate intensity group, and then positive changes in their visual spatial ability and reductions in blood pressure. So we've got a protective factor for the cardiovascular system. We've got further improvement in cognition. We've got some slight improvements in strength. But I think when we really think about this, the protocols, the high intensity group spent half the training time. So the moderate intensity interval training group spent 40 minutes. The high intensity group spent 20. I know clinically we're getting more and more pressure, right? If you're in a insurance-based system, do more with less time, but we want to have the same outcomes. Or maybe you are luckily not in one of those environments, and you've got an hour, 45 minutes. If you can compress your cardiovascular training into a 20-minute period, then you've got 40 minutes to be covering lifestyle factors, to be doing pain relieving exercises, to improve exercise technique for correctives for movement. It can just open up a lot more time for you to be able to work with your clients beyond the training period. So unless someone is on some type of cardiovascular restriction where they've got a limit to their max heart rate, or you're working off some of those lower percentages with someone who had an acute MI, for example, you may have to use a moderate intensity. But for those that don't have a cardiovascular restriction, we're continuing to see this trend that is safe and effective, even for untrained older adults, to do high intensity interval training for a cognitive standpoint, a cardiovascular standpoint. We know that being able to further reduce someone's blood pressure is a great way to help isolate them or reduce the risk of cardiovascular disease long term. So if we can, we want to get people working at a higher intensity, and we can get the same or better outcomes in half the time to save yourself some time clinically, which I think is really the key takeaway here. The other thing that's interesting about this study, as you dig into it, is they were just in a regular gym setting using an exercise bike. So it wasn't any fancy equipment that most of us don't have access to. That is a great way to standardize it, because they were looking at things like power. But I don't think it's unreasonable to either use a percentage of heart rate max, something like the Carbovin formula, or using RPE to measure aerobic output for high versus moderate, because most of us may not have the equipment to be able to track power in our clinic, or if you're in a more acute setting, trying to work with someone after an acute MI or cardiovascular incident. So that is what I've got for you, team. High intensity for the win. Get more done in less time. If you want to catch us out on the road, I'm going to be in just outside of Chicago with Trissa, incredible OT in Lamont, Illinois. We'll be on April 5th. We'll be both in Florida and Colorado, and then the following weekend in Madison, Wisconsin. We've got great opportunities for you there. We're still letting maybe a person or two slide into level 1, our online course. If you have not taken that, you may be able to sneak in just past the deadline. If you're interested, we've still got a few spots left there. Team, that's what I've got for you. Have a great Wednesday. Would love to hear any thoughts on anyone that's using high intensity interval training with their older adults, what their experience has been like.